Well, hello, everyone, and welcome to our first In Conversation series for TogetheRide. Thank you for joining us today. We have a great hour of discussion, questions that we're glad that you are a part of today. I want to welcome you. My name is Russell Royball, and I'm with San Francisco AIDS Foundation. And we're going to be spending the hour talking about the global outlook for HIV/AIDS under a Biden administration. And I want to start by doing a couple of housekeeping announcements. First, if you need closed caption, there is a QR code in the bottom left corner of your screen. So please feel free to utilize that. Also, if you have a question or a comment and you're watching on Twitch or Facebook Live, please enter your questions or your comments there, and we'll have a chance at the near the end of the hour to be able to ask our panelists those questions. And then please stay tuned for the end. We're going to be announcing a special match opportunity from one of our sponsors. So please stay tuned till the end of the conversation today for more information on that. With that, I want to welcome our two panelists today. First, Erin Fox. Erin is the Director of Government Relations at the Los Angeles LGBT Center. Erin has led administrative and legislative strategy on health policy for nearly 10 years at the center, and he's been appointed to the Los Angeles County Commission on HIV, co-chaired the California HIV Alliance, and was selected as an inaugural member of the California Department of Public Health Office of Health Equity. Our second panelist is my colleague from San Francisco AIDS Foundation, Ernest Hopkins. Ernest is a senior strategist and advisor at SFAF and leads its national policy and legislative activities at the federal, administrative, and congressional levels, and has done so for the last 20 plus years. Ernest leads and has led national advocacy coalitions like the National Black Gay Men's Advocacy Coalition and the Communities Advocating Emergency AIDS Relief. So I want to welcome both Erin and Ernest to our conversation today. Hi there, it's good to see you both. I want to start I don't even know what to say. The events of last week, the fact that as we begin this conversation today on the House floor, they are voting to impeach the president for a second time. And what we witnessed last week in Washington, I know as a former Washington resident, I think all of us have lived in DC. It was so heartbreaking and infuriating and sad, and every kind of emotion like that to watch what happened last week in Washington, DC at the Capitol. And so I just wanted to start today to get each of your reflections about that before we get into the conversation. Why don't we start with you, Erin?
So like you, I was glued to the television. I've lived in DC for a couple of years and go there frequently when we're allowed to travel to do advocacy on behalf of the center and our community. And I was both in shock and not in shock at the same time. I don't know if you can be both of those things at the same time, but I feel like this has been building. I know the things that we have heard, even here in Southern California, which especially in LA is obviously a very predominantly progressive blue area. We knew that there were going to be significant actions taken by, white supremacists, people who have demonstrated violent acts in the past. And one of the things that I have always loved about the Capitol and about DC, especially when we've brought in clients with us to tell their own stories to elected officials, is that they're always so surprised how they can just walk into a Capitol office building, as long as they go through security, and actually go into their representative's office and sit down and either talk to their representative or talk to staff. And it, those buildings are the people's buildings. And I believe the Capitol is the people's house. And so I really hope that this doesn't contribute to a further disconnect between our elected officials and their constituents and the clients that we serve. And we're able to still get messages to them. And because of increased safety, which I think is going to happen, that's going to be a little tougher. But I thought that undoubtedly this was a violent coup that was instigated by the president and many members of his party through weeks of lies about the election. And I think since we're talking a little bit globally and internationally, the United States sends election monitors out to other countries to make sure that their elections are safe and that they're fair and that the person that gets the most votes wins. And so I think the United States is going to have to make up some ground on what our democracy really means as the rest of the world views it. And I think we're still in for some tough times ahead. Just because Trump is out of office, I don't think is going to stop a lot of these groups and a lot of these people from trying to really impact our democracy in a negative way.
Thank you, Aaron.
Well,
Ernest, what about you?
Yeah, I'm a native Washingtonian, and I'm actually working remotely from DC, so I'm here now. And the reality is that there are about 20,000 National Guard on the mall at this moment. They have created a perimeter around the Capitol that extends down to 4th Street. So any of you who've been to DC to visit the museums, you'll know where the National Museum of Art is and the East Wing building. So the perimeter is at the East Wing. That is where they have started the perimeter. And so you can't get any closer to the Capitol than that, which is a significant distance. And the show of force that is planned for between now and the shortly after the inaugural is obviously in response to what everyone has agreed was short-sighted planning for the 6th, which resulted in the breaching of the Capitol. I think those of us who live here are used to people coming to protest. That's no big surprise. But, actually attacking the Capitol Police and breaching the doors and inciting a riot, that's new for us. None of us were around in 1814 when it happened the last time for the War of 1812. So, the sacking of the Capitol is huge. And I think it has had a huge impact on the members. Russell noted that, as we're talking, the House is voting on impeachment of the president. And it was very insightful to listen to the speeches of the leadership of the Republican Party, none of whom gave the president a pass. They all acknowledged that he was responsible and should be held to account. They don't think he should be impeached. They'd like to censure him and do a few other things, but they're resistant to the action that's actually occurring. What Aaron said about the freedom of mobility around the Capitol is one of the things that we'll obviously have to wait and see how much of it comes back. But we know that the freedom of egress is changed forever. It'll never be the way it was. And that's a loss for all of us. And we can mourn that because I think people coming to Washington and being able to have that level of access to their representatives is really a beautiful component of democracy. And it's a shame that we've lost it, but security for the members and the staff is paramount. And so we're going to wait to see how much of a change it's going to be during the next congressional session. But it was a wake-up call that words have import, and you can, in fact, if you're the president of the United States, continue to repeat and assert things that result in people taking action on your behalf. And that's what happened. And we'll have to see how we get through the rest of the process.
Yeah, I think that both of our organizations sent notes to our staff teams and made some public comments. And when our team had a discussion last week about stuff, and Ernest, you sent an email to our colleagues. And one of the things that really struck for me in that email that you sent was, and that I felt watching it last week, is whenever I've been at the Capitol, I have such reverence for the kind of place it is. And it's like a sacred building. And to see it desecrated in that way last week and see Confederate flags paraded through its halls, in places that all of us have advocated for the communities that we care about, including folks living with HIV, LGBTQ people, folks of color. Like it was so sad to watch. And I mean, I still get emotional thinking about it because I just have such great reverence for the Capitol and for what happens there. And it just was a very sad day, as is today. So let's get into our conversation. Thank you both for sharing your reflections about what happened. So let's talk about the next administration. And as we kind of get ready to welcome the Biden-Harris administration in just a week from today, I wanted to first talk about the current state of global HIV/AIDS and U.S. policy. Ernest, could you give us a snapshot of where we are in this moment?
I think the best way to describe it is a rebuilding period. We have, the United States has enjoyed the reputation and I think well-earned in some instances of being a leader in health policy. There are programs that have been established by the United States that have provided foreign assistance and aid to countries and people all around the world. Most of those programs survived the last administration, but the tone and the messaging of welcome that has always been so much a part of the reason that people saw the United States as leaders at an international level really has to be rebuilt. America First, a tone poem from the last administration, is going to take some time for us to do away with. There's going to be a lot of fixing that has to be done. And we're in the middle of a global pandemic, another global viral pandemic that is having really dramatic repercussions all over the world. Sadly, the most devastated part of the world with regard to COVID-19 is right here in the United States. But just as here, the epidemic has kind of displayed the ways in which our healthcare infrastructures are being tested and challenged to respond, the same is true in the developing world and other places where the President's Emergency Plan for Emergency AIDS Relief, so PEPFAR, which is our largest global AIDS program, is seeing the results of the strains and the pressures and the additional burden of disease that is happening in those countries that are dealing with COVID as they continue to deal with HIV, malaria, tuberculosis, hepatitis, all of the other issues that we have been pushing against for decades to try to address the healthcare needs of other countries. So, the good news is that the infrastructures have held. We have PEPFAR, it is funded. The country operational plans are in process and will be reviewed in the spring. The Global Fund, representing resources from major countries from all over the world to combat TB, malaria, and HIV. That fund is in place. The United States resources are supporting it. And we are beginning to get a better handle, just as we are in the United States, on how to use the same infrastructures that were developed over time to address those problems, to address COVID-19. I think what is lost on some people is that there's no new team that kind of rushes in and deploys to address COVID-19. It's the same people, the same hospitals, the same infrastructure that was already strained to the brink, addressing these other issues that's now being forced to address COVID-19 on top of everything else. And something has to give. And so what we see, both at a global level and here in the United States, is that those teams that were previously addressing other things are now being redeployed, redirected to address COVID-19 as the emergent critical crisis that it is. That means that people living with HIV who have historically gotten access to their drugs or food or other critically important services are now facing a situation where they're not as easily accessible. And the same people who would normally be doing that are doing something else directed to COVID. And so we're seeing a disconnect and a separation from services, both globally and here in the United States. We're seeing people not picking up their medications, not picking up their prevention meds for PrEP. People skipping their appointments with their doctors or not being able to access their doctors at all, because unlike here in the United States, broadband and smart devices are not as readily accessible in some parts of the world as they are here. And so the notion of telemedicine and telehealth being the alternative, it's not as viable. And so what we see is the United States, through a Biden administration, having to come to terms and grapple with all of that in the midst of an economic downturn globally, in the midst of political unrest, both here and in other parts of the world. Because, of course, when the United States is perceived to be in the midst of political unrest, it provides opportunities for bad actors to engage in opportunistic interventions in various parts of the world that historically it was the US that prevented them from doing. If we are at effect here at home, we're not in a position to actually exert any kind of external pressures on others. So, the healthcare, the political, the resource access, all of those things are what we're dealing with at the beginning of the Biden administration. That first 100 days, when you normally are putting together your cabinet, when you are pulling together the policies for the various departments, is the exact same time that this Congress is more than likely going to also be investigating what they may believe, well, what some of them believe right now are seditious members of their own bodies. And so the notion of cooperation and comity in the body is not going to be easily found. And it creates just one more stressor for an already very difficult situation where the House is more closely divided than it's ever been. The Senate is 50-50, with the vice president essentially being required to be available in order to vote on behalf of the Democratic Party. It's just a very difficult time to be in the midst of so many healthcare crises, but it's where we are. And, I'm just glad that the HIV community has such a history of crisis intervention and management that I think we will continue to lead, not just on HIV, but also on COVID and the other issues, because we know how to do what we need to do, and we have the infrastructure in place to be of assistance to make a difference in COVID and in HIV simultaneously.
Thank you, Ernest. Aaron, do you have anything to add?
I would echo what Ernest said. I think he laid it out really, really well. I would just add that, President-elect Biden has committed to rejoining the World Health Organization, which does significant work around HIV/AIDS and other pandemics throughout the world. And I think right before we got on, I had read that President-elect Biden had named Samantha Power as the director of USAID, which handles a lot of the foreign policy and the foreign aid that's going outside of the United States and those priorities. She was the representative to the United Nations under the Obama administration. She knows these issues very well. She knows LGBTQ issues very well. So I think it really does seem like they're putting the right people in place to change these policies. But again, like Ernest said, we have a lot of making up of ground to do internationally, because many of our relationships with international coalitions and just unilaterally country to country have really suffered under the Trump administration before COVID, and then during COVID, I think things have gotten even worse.
Mm-hmm. I was on a call this morning that there was lots of excitement about Ambassador Power being named as the USAID administrator. Lots of excitement, and so let's hope that all works out. That there's the right people in place to affect policy globally. When we talked last week in preparation for this conversation, we talked about how and Ernest, you mentioned this, that we're in the midst of multiple pandemics around the globe, including COVID-19. Ernest, what impact is COVID having? You talked a little bit about this already, but what impact is COVID having on treatment and prevention globally? And more specifically, we've seen laid bare in the US in particular, the incredible health disparities affecting Black, Indigenous, and Latinx people. Is that also happening globally?
The isolation and lack of access to much needed services and resources is definitely happening globally. I think the disproportionate impact of COVID on Black and First Nation and Latinx communities is really profoundly American. The ways in which the United States manages its healthcare system is really part of the problem. And that's not to say that there aren't really huge problems in South America, Central America, and in some parts of Africa, in the southern region especially. But when you look at Africa, if you look at the numbers, the pandemic has left much of the continent unscathed. Some of the lower numbers in the world of infection rates in COVID-19 are in Africa. But South Africa, which has also already produced a new strain, is one of the places that is suffering. But the United States is quite unique in that each state of the nation develops its own public health system, funds it for the most part, creates its own set of rules, is responsible for its own infrastructure, and also pretty much controls eligibility for the services that are provided. So whereas most countries have a national health system that's available to all, where cost is really not an issue and accessibility is really more about whether there's a slot for you to fill, whether there's a slot for you to actually access on the schedule. Here, it's very different, and it's being exposed in a very profound way. And of course, race, class, discrimination, medical mistrust, all of those issues that we've been dealing with in the HIV epidemic are being exacerbated now by COVID-19, because of course it was the fact that Black people in the early stages of the epidemic were going to the hospital and being turned away, going home and dying at rapid rates, that actually alerted us to the fact that there was a disproportionate rate of death in the Black community. That was really how we discovered it. And ironically, it was because people actually went to the health systems and sought healthcare, which is kind of an unusual thing for my community. So it tells you the severity of a problem that people were facing, because historically, most Black communities will say that we don't go to seek preventive health care at the same rates as other communities. If we go to the emergency room, it's usually because it's really an emergency, because we tend to leave our healthcare needs unaddressed for much longer than we should. And so that, combined with the incredible reductions in budgets that state health departments have been experiencing for years, and a recalcitrance by the Congress to actually infuse money into the states and localities to support what's going on, the crisis has exploded. And so when you're shut down and quarantined and you can't access services, not only do your healthcare needs go unmet, the ones that you've identified, but others begin to pop up. And so what we've seen across the country is an exacerbation of mental health challenges triggered and tied to the fact that we're in this moment of isolation, unable to engage with other people in the ways that we're used to, not able to access the things that we need, with not sufficient resources. It's a recipe for disaster. And one of the things that the Biden administration will have to do is infuse these states and localities with resources to jumpstart the vaccine distribution, as well as expansion of public health to address the multiple situations that we have occurring. There's going to have to be a dramatic increase in public health resources.
Erin, the Los Angeles LGBT Center has had a long-term program with Chinese LGBT activists, some of whom intern at the center and have come on AIDS Life Cycle. For those of you watching that have been on the ride, you know that they join us every year. What has the impact of COVID been on their work in China? And are there intersections between COVID and HIV and what's happening on the ground there?
Definitely. And I just had a conversation with Jeff Chin, who many of you probably know, who's done the ride many, many times and runs our Emerging Leaders program. So essentially right when COVID hit and was fully announced in China, it coincided with the time when the Chinese New Year was happening. And this is a huge, huge travel season in China, where especially a lot of young people go home to their parents' houses in different parts of the country. And then once there was a lockdown, a lot of those people couldn't get back to their homes. And so in China, if you are HIV positive, you are designated to go to a specific infectious disease hospital, probably that's near where you live traditionally. And all of the other hospitals where they were visiting, probably at their parents, were all dealing with COVID. And so specifically in Wuhan province, where one of our graduates of the Emerging Leaders program is the executive director there. They were supposed to come here in February, a contingent of them. That obviously wasn't able to happen. But what they were seeing was that people were getting stuck outside, were getting stuck in provinces where their designated hospital wasn't. And they didn't bring more HIV medication with them because how would they have known that this huge pandemic was going to strike in the middle of the Chinese New Year travel season? And so, for instance, one of the things that the Wuhan LGBT Center was able to do, because they have a history of a very tenuous but efficient working relationship with government entities and public health, they were able to get people who are HIV positive their medications that isn't at their regular hospital, which to my knowledge and Jeff's has not really ever been done before on this scale, which is about 2,500 people. And LGBT centers who do a lot of the HIV work in China have also seen about a 30 to 60% decrease in funding because a lot of that now is either going to COVID or people don't have the disposable income both here in the United States and in China to be able to continue to give to those organizations. So it's definitely had a huge effect depending where you are geographically in China. And if there is another surge, I think we're going to see more of that. Right now, things are looking a lot better in China than they were before. But we continue to monitor the situation and talk to our graduated interns who are still doing all of this fantastic work on the ground, and thank all of the participants of the ride over the years, because you all have contributed for them to be able to continue to do this work, especially in a really rough environment.
Thank you. Now let's turn to priorities for the incoming administration, which we touched a little bit on. In California, both San Francisco AIDS Foundation and the Los Angeles LGBT Center are part of the statewide Ending the Epidemics Coalition, which look not only at HIV, but sexually transmitted infections and HCV or hepatitis C as well. Ernest, is that a priority for SFAF to advocate for a similar plan nationally and internationally? And how will that happen?
Well, I wouldn't say it's a priority to actually have a plan, because at the federal level, there are multiple plans already. We have a strategy on STDs. We have a strategy on hepatitis. We have a strategy on HIV/AIDS. We have a strategy on the opioid epidemic, which is another, which is was prioritized by the Trump administration. One of the few things that we were able to support is, along with the End the Epidemic for HIV plan that they supported. Question becomes coordination. And so one of the things that the Biden administration announced on World AIDS Day is that they plan to restart the Office of National AIDS Policy as a component of the White House. That office has historically been very focused on the HIV epidemic, with, at the end of the Obama administration, some additional focus on health disparities. And so the question becomes, will that office, along with the HHS Office on Infectious Disease, will those two offices coordinate in a way that these epidemics can be coordinated, and the work to address all of them can be done in a seamless way? Because the rationale for doing this in California was just that. You can't end the HIV epidemic with a raging STD epidemic in the same community. And the same is true for hepatitis. They are interlocked and have to be addressed in tandem. I think there are a number of people at the federal level who get that and understand it, but everything is driven by silos of funding. And so at the federal level, it will be important for the next Secretary of HHS to actually prioritize these resources for these different critically important issues to be able to be married. So there's a synergy between them, not competition, not siloing, but that they're interoperative. It's a big task. The feds really like their silos. The bureaucracies are built on them, and so it's very difficult to change from a structural perspective. But I do think that that is a priority for us, is to ensure coordination of those resources and policies, and that these epidemics can be addressed effectively at the state and local level with federal resources through a coordination of these plans.
So, right, we talked a lot today about the different things that are happening at the federal level that have impacts internationally. We talked a little bit about state and local stuff. Erin, and we've gotten a question on Twitch from Nick that is along these same lines, which is, Erin, I'm sure lots of people are asking themselves, what ways can individuals impact local, national, global HIV/AIDS policy, and what can folks do to most effectively have their voice heard? And the question from Twitch that is related to that is, as folks who are not policy folks, who are not policy wonks, what is the way that folks can be most educated on policy decisions, and how can they stay informed?
So I would say, first of all, read reputable news sources to get your information about what's going on. And both our organizations, FSAF and Los Angeles LGBT Center, I know are doing mobilization campaigns, and I think the 2016 election really changed that for all nonprofits who are 501c3s. Unfortunately, we cannot be partisan. So we can't say you should vote for this candidate or you shouldn't vote for this candidate or this party or that party. But in particular, our organization, the LGBT Center, we have a program called the Resistance Squad, which was created directly after the 2016 election, and sort of cut its teeth on protecting the Affordable Care Act, and made phone calls into battleground states to talk to people and then connect them to their senator, which might have been Lisa Murkowski or Susan Collins or Joe Manchin, because a lot of the times us doing work here in California, especially in LA and in the Bay Area, is not the best use of our time, right? We know that our delegations are on board with what we think the policy priorities should be. So for instance, our Resistance Squad just partnered with Equality Georgia to call thousands of LGBT people in Georgia to get them out to vote. And this is something you can do from your home. It's very easy. It's set up very simply. And a lot of people were grateful just to get a phone call and talk to someone, because a lot of these folks that we talked to were aging members of the LGBT community who often don't get out. And then with COVID, it makes it even harder. So one, you can always call your representative at any time. If you want to pick up the phone, you can call them. And someone in their office will speak to you and will hear what you have to say. And that they actually do mark down what kind of calls they get and what kind of policies people are talking about and what they want their representative to do on those policies. And those calls really do matter. A lot of representatives also have online forms that you can fill out. I would recommend, if you feel comfortable, making a phone call. I think is more personal. You actually usually get to talk to someone in the office. But like I said, if you really want to plug in to the programs that our two organizations have been working on over the last couple of years, you can visit our websites and find out how to do that when it says getting involved. And ours is called the Resistance Squad.
Great, thanks, Erin. Again, to reiterate what Erin said about going to the website of the LA Center, lalgbtcenter.org. You can also go to sfaf.org or to join the HIV Advocacy Network at San Francisco AIDS Foundation. You just need to text the word RESIST, RESIST, to 52886. And again, all that information is available on the website. So please join either the Center's Resistance Squad or the HIV Advocacy Network at the foundation. And now I want to take a couple of questions with about 15 minutes left. So I want to take a couple of questions that folks have written into the chat. And I'm going to start with the first one, which is there any plan for the new administration to work with other countries to address HIV/AIDS on a global level? Ernest, you talked a little bit about PEPFAR. If you could just talk a little bit about, like, give a quick definition of what that is in response to the question.
So the President's Emergency Plan for AIDS relief is, PEPFAR, is a global activity that is sponsored by the United States that provides HIV resources, both preventive and treatment, to countries across the globe. So if there's a country that wants to apply for PEPFAR funds, they simply do so, and they have to meet a certain criteria. So it's obviously not a fund that's designed to support Europe, for example. It's a fund that's designed to support the developing nations of the world that don't have the same level of economic infrastructure and resource to combat HIV. So it's primarily focused on the developing world, and the countries apply. They create what I mentioned before, these country operational plans that require that the government work with community to identify key populations and prioritize the ways in which the resources would be spent to ensure that LGBTQ folks, for example, are not left out of a plan because of some political concerns. And then those plans are reviewed and the resources are provided, and they're closely monitored. Dr. Deborah Birx, who is probably well known to folks for her activities during the COVID relief process during the Trump administration, was the Office of Global AIDS Coordination chief, and also the Director of Health Diplomacy for the State Department. That position is still, I think she's gone back to that position. She's announced her retirement, so that's another position that's going to have to be filled by the Biden administration. That position essentially coordinates those over $15 billion of resource. So it's not a small program, it's a very significant effort by the United States.
Our next question, is there any, and Erin, this is for you, is there any plan to increasing health insurance coverage, campaigns to eliminate existing stigma, or work to reduce socioeconomic disparities to improve access to all Americans to HIV/AIDS services, programs, treatment? Is that part of the push going forward?
Absolutely. And you know, President-elect Biden talked extensively about this in the campaign. He was also, as you know, when the president signed the Affordable Care Act, made his very memorable comment about this is a big effing deal. When the Affordable Care Act was signed, that was a huge expansion of healthcare coverage and access, both on the commercial side and in changes to Medi-Cal and to Medicare. Medi-Cal is the California version of Medicaid. And the incoming administration has already promised to expand the Affordable Care Act. And there are also efforts here within California that I know the center and the foundation both support to expand Medi-Cal to California residents who would qualify for it. Unfortunately, because of our budget situation, that's always going to be something that we have to take into consideration. But, you know, one of the big steps that Biden has said he wants to take initially is a significant expansion of the Affordable Care Act.
It's all going to have to be done through a very technical process called budget reconciliation. And the goal is to really expand the subsidies to ensure that people at a more middle class, working class level of income are able to access insurance at affordable levels. But of course, we have a Supreme Court decision that has to come down. The Supreme Court has heard a proposal from the Trump administration to dissolve the ACA. When they heard the case, it seemed that they were disinclined to go in that direction, but we don't know. And so we will wait for that decision as well. But in the meantime, the administration does plan to expand affordability for the Affordable Care Act through a variety of measures.
We have another question that's actually about the COVID, related to the COVID vaccine. And both of you have talked about how really the work over many decades in HIV really prepared us for this moment to develop a vaccine rapidly. The science, most of the major folks that have been on the coronavirus task force, like Dr. Deborah Birx, like Dr. Fauci, really came from the HIV field. And so the question is, the new mRNA COVID vaccine was created in record time. Does this have any impact for potential one day to have an HIV vaccine? Either of you want to take that?
So I sit on the African American Advisory Committee to the COVID Vaccine Clinical Trials Network. So part of that role was actually reviewing all of the plans and the informed consents and their communications to folks who were involved in those clinical trials. And part of what we learned through that process was, just as you said, many of the virologists who were working on SARS-CoV-2 were also simultaneously working on HIV. The work in the vaccine arena that allowed those vaccines to be sequenced, or those viruses to be sequenced and the vaccines to be developed so quickly, all came from the pre-work that had been done around HIV vaccines. So, and the COVID Vaccine Clinical Trials Network sits on top of the HIV Vaccine Clinical Trial Network. It's co-located. All that to say that yes, it had a lot. HIV work had a lot to do with that, and now the learning on the other side potentially will have an impact on HIV. What I have heard about so far is the kinds of vaccines that are characterized as functional cures. I haven't heard about something that actually prevents infection of HIV. What I've heard about are vaccines that actually attenuate HIV in the body, so it renders it essentially harmless. You're living with HIV; it's in your body, but it doesn't replicate in the same way. It doesn't cause destruction of systems. It doesn't cause the inflammation and the other kinds of damage that are usually attributed to HIV. But of course, all of this all of this work has totally energized and excited the research arena. And so it's a really great opportunity for us to look not just for vaccines, but for cure. And I know that work is being done at the NIH.
Aaron, did you have anything you wanted to add here?
No.
So another question, this will be the final question, and then we'll do just some closing comments, is how does TogetheRide dollars support the center and foundation in HIV policy work that is then taken to a national and international stage? Jeff, or Aaron, you talked a little bit about the work that Jeff does at your organization and the Emerging Leaders Program, but what are some of the other things that funds from TogetheRide and AIDS Life Cycle support at the center?
Well, both the center and the foundation receive a lot of government grants, but a significant amount, and those grants come with pages and pages and pages and pages and pages of regulations and what we have to do. And when we have money that allows us to do things like the Resistance Squad, where we call into other states and have people call their senators and fight for healthcare. And we take people to DC, we take people to Sacramento. A lot of those advocacy funds are all general fund dollars, right? There aren't a lot of, there aren't really any that I know, government grants that actually give people money to come advocate for things for their community to the government itself. And so all of the, what's that?
Zero.
Yes. So the funds that are raised through TogetheRide and through Life Cycle are so integral for us to be able to do our work in advocacy and mobilization and policy, because there would be no other funding for the work that we do because it's not out there. And so all of the things that you see us doing and all of the elected officials that we meet with, the bills that we're able to pass, the cuts that we're able to make sure don't happen so people's services don't get cut. All of those are things that are linked to the dollars that we're able to fundraise during TogetheRide and during the Life Cycle. In addition to many, many, many other things, because for instance, we're still operating on a Ryan White Act for HIV that hasn't been reauthorized in over 10 years. And so the epidemic has changed since then, and people need different things and different services. And so a lot of the money that we're able to fundraise on our own is able to give people full wraparound services that they need, that they might not be able to obtain through a grant that was written over 10 years ago and hasn't been reauthorized by Congress.
Thank you, Aaron. And I just want to say thank you to both of you for this great conversation. We can keep talking about the policy work at the local, state, federal, and international level. Like, I love this stuff. So, and in particular, what's going on in the moments that we're living in. So I want to thank you, Aaron. Thank you, Ernest, for spending the last hour having this conversation. And I want to thank all of you for joining us today. As Aaron talked about, the money that you raise through TogetheRide is so important for us to continue to be able to advocate for the communities that we care about, for people living with HIV, for people who use substances, for folks of color, for LGBTQ people. And so thank you for what you're doing to continue to raise money for the Los Angeles LGBT Center and for San Francisco AIDS Foundation. And on that note, I want to talk a little bit about a challenge that we have from one of our corporate partners and announce in the next Gilead Matching Challenge. Our friends at Gilead have come through again and are putting another $25,000 into a match challenge. Starting today at 2 p.m. Pacific, the first 50 people to raise $500 for TogetheRide will get a $500 match from Gilead. You can start fundraising immediately and visit TogetheRide.org. If you haven't signed up and want to sign up, you can do that today. Again, just go to TogetheRide.org, and this information is in the Helpful Participant Center with other resources around how you can raise funds for the center and for the foundation. If you aren't registered, you can register now and get started. TogetheRide is for everyone, everywhere. You don't need to have a bike. There are lots of ways that you can participate, no matter what age or your fitness level, and invite your family and friends to join you. We are on the road to raising a very critical $5 million by June 30th for HIV and AIDS-related care. And we can't do this work without you. And in particular, both Aaron and Ernest talked about the impact that COVID is having. It's certainly having that impact on each of our agencies. And both of our agencies are continuing to provide life-saving and life-changing services for folks in the greater Los Angeles area and in the Bay Area. And so your support is needed now more than ever. So again, Aaron and Ernest, thanks for this great conversation.
Thank you.
And thanks to all of you for joining us, and we'll see you soon.
Okay. Bye.